I'm Nidhi Sinha, editor Outlook Money, and I'm in conversation with Mr. Tapan Singhel, MD and CEO of Bajaj Allianz General Insurance, and he'll tell us about the relationship between health, wellness, and insurance and how they seamlessly fit in with each other. Welcome, Mr. Singhel, to the show.
Thank you. My honor, Nidhi.
So, we see this relationship these days between these three concepts which are arising, and a lot of insurers are also laying a lot of emphasis on wellness. So, could you explain to our viewers on how this relationship works?
Okay, so if you look at it fundamentally, I think if I look at insurance, though we protect when things go wrong, but one of our obsession is how do we contribute to society in making society a better place, you know? And we feel that one, if somebody falls ill, yes, we are there, we should take care. But how can we contribute on wellness? You know? Because again, we have a huge ecosystem around us, no? Right from hospitals to diagnostics to, you know, putting together an entire chain of, you know, maybe a gym or no. So, and then we have a lot of data points also coming together, and how can we put that all into one place. So one of the obsession that as a company, the industry we have is that can we be a major contributor to wellness of the society? Can we, you know, raise the bar there? And obviously health insurance there to take care. So somewhere we'll be talking of giving discounts on the premium if you are, you know, healthy, or if you are doing number of so much track, or somewhere we would be giving you even simple OPD cover also, no? Like what we give is also part of wellness, because you don't realize that a lot of time, a lot of people hesitate, and I've seen this, no? Let's say with my friends, when there's no cover, then they feel okay. If there's a headache, then go to the chemist and ask what medicine should I take, and the chemist should not give them some XYZ medicine. And when they have a good OPD cover, they don't hesitate. They go to the best place, and they're able to know figure out what is there. So even a good OPD cover also contributes to wellness, because it's preemptive in a lot of times, you know. Or something like a tele-consultation with a doctor. So when you're not well, you can just reach out and have a consultation done wherever you are. Those things act in a big way in prevention, you know. While fitness, you know, if you walk every day, it's good. I think I was reading a study that it's not about how much weight you have, it's about how fit you are, no? Which makes a difference to your longevity and your happiness and your, no, wellness. So a lot of this myths about in terms of how would you look if you are, no, like so much X weight or not, it has to be broken. I think somewhere we talk about wellness, somewhere we talk about how do you feel happy, somewhere we talk about mental, no, health, somewhere we talk about, no, giving you adequate reach when things go wrong. And it's a combination of all this, Nidhi, which comes together. Now is what the industry and the company is working towards.
Yeah. So also, like you were talking about, also health insurers also have started looking at people who kind of strive to remain fit favorably, and there are a whole set of reward points that some insurance companies give. So could you explain what's the, you know, why do insurers do that? How does it benefit them, like from the industry point of view in that sense?
Yeah, so obviously there would be a benefit, but again remember, let's say if you have people who are healthier, the claims should be lower, no? The claim cost comes down. So it looks like it's benefiting the insurance company. What we don't realize is that in the basics of, if you look at the basics of insurance business, it is like you collect money from many to pay to a few. No, this is the insurance business, no?
Right.
Like you collect from 100, you pay to a couple of, no, that. So you collect less money, and extra money, or no, big money goes out for a couple of people. So let's say if the money which goes out becomes less, then the collection of money from many will also become less, no? It's cyclic, no? I think somewhere to keep in mind that, and it's actually a very good question you asked, Nidhi, because a lot of times you would think that, okay, this is benefiting insurance companies, so that's why they're pushing for wellness. Is it so? I don't think so, because if the claim outgo reduces, then the overall premium reduces for everybody, you know, from where it gets collected. It's a very positive cycle, and I mentioned from the industry perspective, no, the obsession is how do you contribute to society, and how do you, know, keep everything, no, better than what it would have been before you started making a difference to that. I think that is one of our obsessions and the way we look at it.
Right. So you are talking about that positive cycle. So in the same vein, I would like to ask that what is it that policy holders get out of it? How do they benefit?
Yes. So let's say you have a lot of these schemes that if you are taking care of yourself, if you're joining a gym, you're walking so much, you have a reduction in premium. That is like an incentive. That would be there, but the way I look at it, okay, you may have a reduction of premium of X percentage. As it is, the premium is not very expensive, if I look at the Indian context. And X percentage of that would be maybe insignificant from that perspective. But the benefit that you got as an individual is huge. I think so. What we should think about is that use the ecosystem, use what has been created by the insurance industry, and if you get a reduction premium, very good, which is like an incentive for you. But think that it really is a huge benefit to you, because the healthier you are, the happier you are, the better life you have.
Right, right. So that makes me think that this whole concept of preventive healthcare that is coming into insurance, we see a lot of it in Indian traditional wisdom also.
Yeah.
Like our dadis would tell us that, have adrak when it is winters and things like that. So how do you view that? Is there, something like that is being adapted and being modernized? So how do you view this whole relation?
So I think if I look at the statement you made that your dadi mentioned that have adrak would be good. If you look at any ancient civilization, and India being one of it, every household, every person is a health champion. If you look at it, the ancient wisdom. So adrak having is actually a treatment in Ayurvedic terms, how it would go. If you look at meditation, yoga, or being in the sun when winters, they would tell go play in the sun. All that now today in the modern science or technology is being spoken about.
Right.
But this have been happening for ages together because of thousands of years of civilization. That is how it has got ingrained in every household.
Right.
So that would be there, which 100% should be taken care of. But if you look at the insurance industry, what did we do? We started accepting Ayush as we call it, as part of reimbursement of claims. We started accepting mental health as part of the reimbursement of claims. So the idea is that the industry keeps encouraging you to be healthier and you to be happier, which is from that perspective, and the industry keeps on adding a lot of things to make it from that perspective a very good cover for you.
Right. You were talking about mental health. That has become a real problem, especially with rapid urbanization. People are becoming lonely as families become smaller and workspaces become more hectic. So on the mental health issue, what is the insurance industry doing right now, and what is the plan ahead in terms of developing it even further?
So mental health is covered in your policy. That is definitely there. If you look at the OPD cover that we have, also provide like reimbursement of consulting for mental health. Also we have telecalling, where you can call up and speak to somebody in terms of looking at your mental health. So all that the industry is already put together as a company, the entire ecosystem where you can reach out. We are talking a lot of people from the mental health, be it NGOs, be it doctors, and seeing how can we make it much better as time progresses. In fact, right now also we have a current project going on in seeing what is that has got left out now, what more can be added.
Yeah.
Data is an issue with mental health. I think that is the biggest problem. Authentic, good data, because as an insurer require good data to be able to design products.
Right.
That would be an issue. But having said that, even without that also, I think the industry has gone ahead and provided cover for mental health. And with more data coming in, we're refining and making it much better. Yeah.
Because the other problem with mental health is that a lot of times hospitalization doesn't happen. It is like these frequent visits and all of that. So you think the OPD cover that covers everything, as in it really is serving
OPD,
that purpose?
Yeah, the OPD itself is a step in that direction. It takes care of it. And the second issue, like you said, where hospitalization is there, that is taken care of in terms of how it goes together.
Right.
Now the frequent visit also, if you look at it, not from the data, whatever we have seen, it's not that everybody has to go frequently. It says that most people have mental health issues, and for most people, it's one-off.
Yeah.
It's one-off in a lifetime. That for some months, they would be having that. So it is not that expensive as you would think about the way. The ones which is recurring and which goes beyond the normal consulting would lead to hospitalization and payment on that. So we're trying to see also in data points what are the gaps left, if any, in trying to address that.
Right, right. So finally, the Outlook Money has this retirement platform, and we keep talking about it. So what is the role of wellness that seniors should consider? And do you think that if that is something that they take care of, will it lead to better relationships with insurers in terms of better outcomes, in terms of their interactivity?
So the way, again, these are studies, which we are again putting it together. Let's say as a company, we were one of the first to come out. That something goes wrong, we have an SOS button. If they press that, you immediately have a call coming to you. You have ambulance coming to you, taking care of you, taking to hospital, even before children can arrive. So first and foremost, look at the ecosystem which you have. If things go wrong, how fast do you get a response? The golden hour, as you call it, because that will make a difference of your quality of life. That's the first thing.
Absolutely.
The second thing you should take care of about is in terms of the social circle that you have. How do you build a good social circle even before you hit retirement? Because loneliness would cause more problem than anything else. So focus a lot on your social circle when things are going good. Like take a good health insurance when things are going good. It's like that, no? When you're retired, when you're lonely, then you start looking at, then it takes more time. But when in the pink of health and things are good, and you have a big circle, invest in that. Family and friends, invest in that. And walk every day. I think that is something which makes a huge difference. Laugh a lot, spend time with people. So I think over time, distillation, all these shows, it's just taken people away from being with each other. So the study that we see is that if you are with people, if you have a social circle, if you're walking every day, if you know in an emergency what to do, if you have an ecosystem which can take care of you, is what makes a huge difference. As an insurer, we're trying to see how do we build that ecosystem for our people and customers, so that we can take care of whatever learnings that we have. How do we keep on cooperating with our friends, partners, and how do we put it together?
Right. Thank you so much, Mr. Singhel, for being on this show. And to our viewers, I think there were a lot of helpful tips and a lot of encouragement to make wellness a part of your life. I hope you enjoyed the show, and see you soon for another episode of this show.